Well, good afternoon. Hey, my name is Dr. Mark Freeman. I'm the medical director for Telemedica LLC. I'm an expert in the physical health assessments, whereas they have many experts at Telemedica LLC with the mental health assessments. But in any case, today we're here to cover our monthly topic. And this month, the topic of this month has to do with balance disorders. I'm sure everybody's experienced at some point in time a imbalance, if you will, and it's not a good feeling. It's kind of a scary feeling. Today we're going to go over some of the most common balance disorders and why they are, where they might come from, what we might be able to do about them. So let's just talk briefly about an umbrella term of balance disorders. We usually have heard of vertigo before, which is a type of false sensation of spinning, if you will. So a lot of these balance disorders come from three flavors, if you will. The CNS, or central nervous system, which can be caused by certain concussions or mild TBI, or traumatic brain injuries, some migraine-associated vertigos, some tumors that can cause vertigo, stroke trauma can cause vertigo, multiple sclerosis, and many other central nervous system disorders. Another flavor are vestibular disorders, which we're going to hone in on a little bit later. But these can be like BPPV, which stands for benign, paroxysmal, positional vertigo. And then another one, which we'll talk about later, is Meniere's disease. There's others that have to do with vestibular pathology, like labyrinthitis, ototoxic vestibular pathology, vestibular neuritis, all these type of vestibular disorders. Now, there's some other flavors called other balance conditions, such as acoustic neuromas, maybe viral infections of the inner ear, CPA tumors, which stands for cerebellopontine angle tumors. These are many different sources of what can initiate this vertigo or spinning type of sensation, if you will. Some of the most common, the types of vestibular disorders, we want to hone in on the vestibular portion, which the vestibular or vestibular means a system in your inner ear that sends signals to your brain to tell you where you are in space. Okay, and so keep that in mind. This is an inner ear type pathology. So vestibular disease, which is a generalized umbrella term used to encompass many different conditions that affect their, quote, inner ear, and those parts of the central nervous system involved in maintaining your balance. There are more than 25 known vestibular disorders. Each is unique, but many share common diagnostic traits, which can make it difficult for even healthcare professionals to differentiate. While most people may not be familiar with the word vestibular, which is, again, let me define it. It's a system in your inner ear that sends signals to your brain to tell you where you are in space. But many of us have likely experienced this awkward, sometimes even scary feeling when we momentarily lose our balance, okay? Whether it comes on gradually or over time, or all of a sudden, bouts of dizziness, vertigo, nausea, vomiting can make many of life's routine tasks virtually intolerable. Everyday life, from getting around your house to grocery shopping, suddenly becomes a progressively challenging obstacle or obstacle course to even navigate. The most commonly diagnosed vestibular disorders include, like we mentioned earlier, benign paroxysmal positional vertigo, or known BPPV, maybe labyrinthitis or vestibular neuritis, Meniere's disease, which we'll cover in more detail, and secondary endolymphatic hydrops. Vestibular disorders also include superior semicircular canal dehiscence, acoustic neuromas, perilymph fistulas, ototoxicity, enlarged vestibular aqueduct, migraine-associated vertigo. These are some of the other types of vertigo due to vestibular disorders, which we won't have time to go over all of them, as a matter of fact. I don't even like saying those 50-cent words. We're going to keep it down in the nickel and dime section, okay? Some other problems related to vestibular dysfunctions include complications, say, from aging, maybe some autoimmune disorders, maybe even allergies can cause some vestibular dizziness, if you will. So let's get down into those vestibular disorders, which are the most common. Again, I mentioned BPPV, benign paroxysmal positional vertigo, is the most common cause of vertigo, which is, again, it's a false sense of spinning, if you will. It occurs when some of the calcium carbonate crystals, we call it otoconia or just crystals for short, that are normally embedded or seated in their appropriate positions, when they become dislodged and they migrate to a position where they're not supposed to be, say in another semicircular canal, of the 3 semicircular canals, they're just not in the seat that they're supposed to be in, and that can cause an imbalance, if you will. It causes episodes of vertigo. Keep this in mind. I'm going to mention a couple keywords, one of which is episodes of vertigo. It's triggered by movement and changes in position, hence the name benign positional vertigo. It can be effectively treated, and that's another key phrase, effectively treated with appropriate mechanical maneuvers, we call Epley maneuvers, usually performed by qualified healthcare professional. In contrast to Meniere's disease, which is a chronic, incurable vestibular or inner ear disorder, that produces recurring set of symptoms, such as results in abnormally large amounts of fluid called endolymph collecting in the inner ear. And we'll discuss some of the comparisons and contrasts of those two in just a minute. So Meniere's disease may start with fluctuating hearing loss, eventually progressing to attacks of vertigo and dizziness. One of the key components with Meniere's is no treatment currently exists to cure Meniere's disease. However, there are medical treatments that exist that can help management. All right, so the 2 most common vestibular disorders of balance are benign paroxysmal positional vertigo, which is episodic, it's curable, and it's not chronic in its nature. It can be used, there's treatments like maneuvers that can be the Epley maneuvers that can be instituted in order to correct the pathology, as compared to Meniere's disease. And we call that a disease because it is a incurable inner ear disorder, and it produces a recurring set of symptoms such as the vertigo and nausea. And this is due to a different deal other than crystals that are unseated from where they're supposed to be. This is due to an abnormally large amount of endolymph that's collecting in the inner ear. So we don't know exactly what causes Meniere's, but it may start with some fluctuating hearing loss and all, but eventually it progresses to attacks, if you will, not just episodes, but attacks of vertigo and dizziness. And there's no real treatment, but there's no real treatment to cure it, but there's some treatment to help manage it. So again, I'm just going to briefly summarize balance disorders. Oh, by the way, because this is very apropos, because starting next week, I think, is the Balance Awareness Week. How apropos that have this topic of discussion of balance disorders. We're particularly specifying vestibular balance disorders, and other 2 of many vestibular disorders. We're focusing in on 2, those being BPPV, which is the most common episodic and curable type, and the other is Meniere's disease, not as common and it's very chronic, not episodic. It's not curable, but there are treatments to help manage this condition. I think we've gone over a lot about balance and some specific disorders having to do with the vestibular abnormalities, and I picked these two mainly because these are the most common, and it's quite understandable. The rest of those conditions with those big 50-cent words, we don't have time to go over that. Anyway, at this point in time, I would be able to entertain any questions you might have, and I'd like to field some questions now if you'd like to start. Are there any questions about balance disorders, particularly vestibular balance disorders, and most particularly those two, benign paroxysmal positional vertigo and or Meniere's disease? Here's a question. What are some of the natural remedies I could try for my vertigo? That's very good. Okay, so as I said with BPPV, there are maneuvers which are natural, and it's usually healthcare professionals that can do these maneuvers. I would suggest a professional, but they can be learned, and even to the point where your spouse can do them for you if your type of vertigo is that episodic benign positional type vertigo. If there's other type vertigos, then first things first, you got to get the appropriate diagnosis. And second thing is you need to get the appropriate professional to recommend their natural, if you will, a natural remedy. So it depends, I guess, on the type of balance disorder you have, whether it's a central nervous disorder, a vestibular disorder, or an age-related disorder. You don't want to go around messing with disorders that are caused by tumors or abnormal anatomical structures with until you know exactly what it is. I can't recommend a specific natural remedy, but it's a great question. I love natural remedies. I hope that answers your question. Are there any other questions? It's a question from Rich. What is the progressive window for Meniere's disease? Worse over years, rapid progression, etc.? Very good question. So as we said before, Meniere's is a incurable, slowly progressive chronic disorder or disease, if you will, having to do with too much production of the endolymph that is settled into the inner ear. I don't know that they have any new I wouldn't say procedures or interventions, I would say, that can help relieve that inner ear of the amount of fluid. I'm not certain. I know in other conditions of CNS disorders with brain swelling and increased pressure, they're able to, through the use of glucocorticosteroids, reduce some of the swelling or inflammation in that area. I don't know if they can specify or specifically target the vestibule in one ear, much less the other. So as far as progression is concerned, to answer that question, simply put, everybody is individual. There's no set time that Meniere's will progress, but we know it won't regress unless there's some sort of intervention that I don't know about. But it is chronic in its state, and it will progress, worsening progression over months, over years. I can't really answer that with a specificity that you might want, but I hope that answer addresses some of your question. Very good, Richard. Is there any other questions? How do I get started with Telemedica? Oh, great question. Well, Telemedica, you can go to the website at telemedicallc.org or .com, or telemedicallc.com, and or you go to that website and they'll have other contact information such as their phone number and email address at support@telemedicallc.com, customer service at telemedicallc.com, and the phone number 512-883-8446. I hope that answers your question. Any other questions I might be able to field right now? Any thing having to do with the two most common types of vertigo that we've discussed today, that being PPV, and Meniere's disease, one of which is episodic, the other of which is chronic, one of which can be curable or at least relieved, symptoms relieved with certain maneuvers called Epley maneuvers, and the other is not curable but can be maintained with certain treatment protocols. Any other questions? Great. Oh, one other. What kind of medical documentation do I need to prove my balance disorder is service-connected other than a nexus? Well, very good question. So there's certain DBQs that are available and to be filled out. There's certain questions on the DBQs, certain tests, that specifically the Dix-Hall-Pike test, which to determine if your vertigo is a positional type vertigo. There's a Romberg test, another neurological test to see if you have upper motor neuron disease, that your dizziness or vertigo could be caused by something else in the CNS or central nervous system. And so there's the biggest, I would say, documentation. If you've been to an ENT, or you've been to a neurologist, or you've had some CT scans, or you've just had a regular physical with someone who knows what they're doing, that can do these type of neurological tests or pathology, such as the Dix-Hall-Pike maneuvers, and testing any type of nystagmus that you might have, the eyes that are quivering and in the end range of lateral gaze to the right or to the left. A lot of these tests, if this can be documented on a normal DBQ for balance and vertigo. Your CMP examiner, as a matter of fact, should have the access to the DBQs and be able to do these particular tests and document that. That actually would be apropos for documentation of said contention of vertigo. The problem with vertigo, it's a broad spectrum categorical description of something that requires more defined diagnosis, be it come from central nervous system, vestibular, or other type aging or autoimmune disorders. But once you get down to the specific identification or the true diagnosis, then you can have documentation based on certain presentations that'll lead you to the ability to make that claim and be able to obtain the benefits for said disability. Very good question, by the way. Any other questions before I wrap this up? Very good. Okay, well, this month, no other questions right now. I think this month's topic of discussion on balance disorders has been very apropos. I think we've gone from generalized to specific and more those diagnoses that are more easily recognized in the lay public and in the veteran community. I hope we've answered the questions to the best of our ability. And I look forward to seeing you next month, which the topic of discussion next month will be ED. Doesn't stand for education either. So if any of you guys are interested in know more about erectile dysfunction, we'll be discussing that next month. So as of now, visit telemedicallc.com, and there's other contact information on the website. And we've had a good day. Thank you very much. This is Dr. Freeman, Medical Director, Telemedica, LLC.